So Laura and I are going to tell you a bit about the Black Maternity Matters story. We're going to start with, what it's all about, how it came about, what it is, what we're going to do next, what's been driving us. So throughout the presentation, you will hear more about Black Maternity Matters, and also there's a short video for you to watch as well in the middle of the presentation. So if we move on to the next slide, really I wanted to stress that Black Maternity Matters is a collaborative, and it's a sum of its parts. It really is. And we have been working with some really incredible, amazing people during the last over 3 years now that we've been working on Black Maternity Matters. This is a picture of some of us at our celebration graduation event last November. We have a graduation event for everybody that comes through the programme. And just to tell you a little bit about them, so Katie is from BCOCO, which stands for Building Cohesive Communities, and she's one of our anti-racist educators. Sona is from Black Mothers Matter, which is a community group who support and celebrate Black pregnancies. And they've been absolutely amazing and really instrumental in the journey that we've been on. And Aisha from Representation Matters, who heads up this organisation called Representation Matters, which really looks at addressing anti-racist practice and promoting practices that challenge racism. We've also, that's our little logo for Health Innovation West of England. We also were very well supported by the Health Foundation in our pilot. And of course, without our NHS trusts and organisations and local maternity and neonatal systems, we wouldn't have the programme at all, because they've really embraced this and come on the Black Maternity Matters journey with us. So that's a little bit about the collaborative. We'll say a little bit more later on in a bit more detail. So if we go on to the next slide, we often talk about our sort of 3 C's, our collaboration, courage and compassion. And I think the courage is something that we all have to have within us in order to challenge racism. So to put yourself forward, to be on the programme, to learn, to unlearn things that you've just considered as the norm for so long. But it's also the courage of our educators to deliver the programme, and the courage of the organisations to trust in us, that to send their staff on 6-month programme was something that was really worthwhile. And just including this quote from Angela Davis here: in a racist society, it is not enough to be non-racist. We must be anti-racist. And that's what we all learn when we're on the programme. So next slide, please, and I'll hand over to Laura now.
Thank you, Anne. We have compassion in everything we do within Black Maternity Matters. I think with the participants, we have to be open and show compassion to reflect on ourselves and our beliefs, and recognise where our part as individuals or as part of a system can impact and perpetuate harmful practices that affect Black women. And as you can see from the quote, that it is recognising those soft and those light things that over time accumulate and can become something hard and heavy and potentially dangerous. And when we start to see that, it can be quite eye-opening for some people, and also difficult to recognise and to challenge that in yourself. So we did also need to have compassion towards ourselves to go on the journey to move forward. Next slide, please. So an overview of why Black Maternity Matters started. So I'm sure most people know about the statistics from the Remmers report, which there is a link to in the references, the resource list as well, which has been talking about for a long time that Black women still face significant disparities in maternal health outcomes. And there are various reports which show that Black women are experiencing higher mortality rates, stillbirth rates, and traumatic births compared to their white counterparts. And we know that there is no biological reason for this to happen. The disparities are rooted in systemic bias, structural racism, and lack of racial literacy in healthcare services. So we at Black Maternity Matters see this as an urgent patient safety issue. So the collaborative was launched in 2020 to bring together an anti-racist programme that is steeped in anti-racist education and bringing about measurable actions through quality improvement transformation projects for perinatal staff and senior leaders across the west of England. Next slide, please. And we like to start with this quote, which is from Sona, who is one of the directors of Black Mothers Matter. And we start with this quote as a reminder to us at every opportunity possible to say that we are moving the onus for reducing health inequalities away from the people who are at risk of experiencing them and moving the onus onto those who are providing the care.
Next slide, please. Thank you. So there is so much evidence out there. Laura's already referred to the Embrace report. We've had a number of very large surveys of Black women's experience of maternity services. This one is a quote from the Birth Rights report, Systemic Racism, Not Broken Bodies. And this was carried out in 2022. And the evidence that was gathered uncovered systemic racism in maternity care. And they surveyed a wide range of people, clinicians, obstetricians, midwives, lawyers, and over 300 Black and brown mixed ethnicity women and birthing people. And that's where they got their conclusion from. And this quote here is really is an example of many women's experiences of maternity services that is affected because of systemic racism, and really quite harrowing to read some of these stories, but very important that we do and we understand them, and we start to think about how that impacts not only on people's experience of maternity care, but also the outcomes and how much they are going to come forward to us to care for them if they have these experiences, or they've heard these experiences from their friends and neighbours. Next slide, please. There's such a lot of evidence. We've just put a few quotes and reports here. The Systemic Racism, Not Broken Bodies is there. There's also the 5X More report. I'm sure many of you will have heard of 5X More, and they did a study of Black women's experience of maternity services. And they've also done, they have sort of initiated a lot of parliamentary activity. And so really, if you haven't heard of 5X More, then they're a good one to pick up and follow to find out what they're doing. There's also a number of high profile cases where racism has affected care, and it's tragic that should result on occasion in a fatal outcome. And it's tragic for the family. It's also tragic for the staff as well. People don't set out to do harm. And that's why we need to learn so much from the things that we have become accustomed to not seeing, to open our eyes, to see and to address those issues. In the summer, unfortunately, racism reared its ugly head on our streets. And that was really incredibly frightening. And I think for a lot of us that have been working in this area, it was a real shock as well, because I think you think that this would not happen. This would not happen in 2024 because we've moved on so much, we've learned so much. But people that we were working with who were afraid to go out of their front door, that's not what we want. It's just a reminder of that, and how we all need to think about how we can make those changes. To the next slide, please. So our vision, and this, as Laura referred to, really this came out of a lot of conversations, and Black Mothers Matter were really kind of the inspiration for us to do something a little bit differently. We've had a lot of anti-racist training, we've had e-learning, we've had mandatory training, but it doesn't seem to have made a lasting impact on outcomes and experiences. And they really felt very strongly that if we were going to do anything around education, anti-racist education, that we made sure that it resulted in improvement. So the programme has at its heart equality improvement, as well as the education. So our vision is to reduce racial disparities through an anti-racism approach, and to really try and have that impact that over a period of time will transform our organisations into anti-racist organisations. And it's also important to move the onus away from women and babies racialised as Black, and instead onto our systems that perpetuate this. And our focus is obviously what we want as an ideal outcome is a reduction in morbidity and mortality, and improved outcomes and experiences. Next slide, please. Now, the next slide is actually a video. So a short 4-minute video that will tell you a little bit more about Black Maternity Matters from a film we made last summer.
Black Maternity Matters is inspired by the vision that one day women racialised as Black will no longer be disproportionately in danger during pregnancy and the first year after birth of their babies. The statistics are grim. When I had my youngest child, I learned that as a Black woman giving birth in the UK, I was 5 times more likely to die during childbirth or up to 6 weeks after. The statistics continue to tell us that Black babies are more than twice as likely to be stillborn. We've developed an innovative 6-month anti-racism education and training programme designed specifically for staff working in maternity and neonatal services.
This is very innovative and quite revolutionary. Most people are used to getting a 30-minute e-learning module, and we're saying commit for 6 months of your life to go on a journey with us. It is a vast difference in approach, and it's a real immersive practice that we're providing people to step into.
The journey invites our participants to get introspective, to think about who they are, their belief systems, values, principles, their understanding of race and racism. Okay, so we start with building some foundations for them, okay, doing a bit of myth busting, especially through the lens of their profession.
Black Maternity Matters is making a difference on so many levels, but I think most significantly is the transformation of individuals and teams and organisations to really embrace and embed anti-racist practice and theory.
Everybody that comes on Black Maternity Matters programme, I'm doing it myself at the moment, I'm currently one of the participants, and it is a total transformation. You are learning so much, and you're unlearning a lot as well.
Unless we're actively anti-racist. We are passively allowing racism to continue in a systemic way. Definitely everyone in the NHS needs to have the opportunity to really examine what racism is, where it's happening and what their part in it is. Are you passively allowing it to happen, and how do you stop that? Because most of us are passively allowing it to happen, and I never thought I would say that.
What's been really beautiful about this work is we now have a cohort of leaders, and that's a beautiful opportunity because we have the people in the system who have the power to make institutional change. That's transformational because not only are we talking about what we do on the ground, we talk about policy, systems and guidance, and that's when we can really begin to see the ripple effects of our work. That's massive.
Because the power that they have, and when they get it, they really get it, and they can really make a difference. So it is very, very exciting, a little bit daunting because it feels as though it's getting very big, and I think that's one of the reasons that we've wanted to take our time, is because we've always wanted to keep the integrity of the programme and not to lose that.
Our ambition and goal for Black Maternity Matters is that it's in every NHS trust across the UK, and that it really is embedded, and the anti-racist practice and theory and the compassion and kindness and collaboration it brings is just part of how we work in the NHS.
We started our community groups bringing together Black women in Bristol about 3 years ago, and when we started, when people would come to us and share their nervousness about leaning into NHS services, there wasn't much we could say. But now we're on phase 4 of Black Maternity Matters. I'm proud to say, with a bit more confidence, I can say actually there are lots of people that are working in the settings that you're going to be engaging in that are on this journey and are committing to doing better by you.
So there you saw Aisha and Katie, who deliver our training, and they're both highly experienced and have their own lived experience as well. And we also had a wider group of clinical stakeholders from the LMNS and the trusts that we work with to contribute to the educational content. And it's been an amazing experience to work with Katie and Aisha and have the benefit of their skills in delivering this education. And Black Mothers Matter, you saw there Sonna, and I talked about the inspiration that they gave us for Black Maternity Matters, and they are our key community stakeholder, and if ever this was replicated in other parts of the country, I think that's the first thing that you have to do, is to find your community so that you can involve them in the development of the programme. We've coordinated the programme from Health Innovation West of England, and we've worked very closely with our local maternity and neonatal systems and of course our NHS trusts. Next slide, please. Collaboration I've already talked about. We do involve everybody wherever we can in sharing and celebrating and learning as well. There's still an awful lot for us to learn, but it has really been quite successful in terms of bringing people together from all different parts of the system and outside of the NHS as well, where we've sought expertise to be able to provide this programme. Next slide, please. Over to you, Laura.
Thank you. So the Black Maternity Matters model. So it's a 6-month programme which consists of once a month having a face-to-face in-person session, followed by the next month will be a virtual book club. And all of this is grounded in anti-racism theory and practice with that perinatal context. For every cohort and every trust will have a maternity champion who is there to support and to lead in the sessions and outside of the sessions. And throughout the whole program, we've got quality improvement coaching available, so that right from the beginning, we can start to think about how we can turn the learning that we've done into measurable changes and measurable outcomes. So we start thinking about the projects throughout. Very exciting that after some evaluations, we were able to develop a senior leaders cohort as well, which had senior leaders such as chief executives, chief nursing and midwifery officer from across the southwest, who have been able to take part in a separate anti-racism journey, but also across a 6-month period with with a very similar format. And that felt really important to do, so that we can make sure that the changes are happening from the top down as well as the bottom up, and making sure that we've got buy-in across the board, so that we're making changes from as many different angles as possible. And Black Maternity Matters really feels like a community in a way, because once you've started on that journey, it doesn't really end at the 6 months. You're kind of part of the community for life, really. We have created specialist interest groups, which links people together from across the region who are doing similar quality improvement projects, so that we're all working together and sharing that learning. We have continued outside of the 6 months to have more discussions and having sessions on trauma-informed care, which was by another leading expert, which is a really fantastic session that I was able to attend on trauma-informed care. And we had another really important one was that we did a Brave Space sessions, which was for professionals who are racialized as Black to have a separate sort of restorative session, which to bring people together to connect, because we recognize that talking about racial trauma has an extra layer of difficulty if you are also somebody who potentially has experienced racial trauma yourself. So over the course, we've had at least about 200 people across the southwest who have joined the Black Maternity Matters community. Next slide, please. And here are just some of the photos from some of the cohorts that we've had so far. Next slide, please. And what makes Black Maternity Matters unique is that it really is more than a training program, because right from the beginning, we're focusing on how can we translate this learning into measurable action. And we know that organisations having their staff committing to a 6-month programme is a really big ask and quite a brave thing to do for really stretched maternity services. And we're really grateful to be able to do that. But we know that having a 6-month programme, which is a sustained period of learning, is really important to sort of embed that learning that we're doing and to go on that journey, because you can then take what you've learned in those sessions, go back to your place of work and start to see how this impacts on you, or see where the biases are in your place of work. And then you've got the opportunity to then come back to the people in your cohort to talk about it. So it's that kind of sustained, embedded learning that is really important to kind of continue the journey. And it just gives people the opportunity to come back and talk to the participants. And it's the compassion, courage, and collaboration that keeps the momentum of the project going as the participation increases over the cohorts. And the model is designed for the long term, to be able to grow and to be able to spread as far and wide as possible as the projects continue. Next slide, please.
So just to show you a map so you can see geographically the area that we've been covering. We started in the Bristol areas, and that's where we've had the most cohorts go through. So that's why you can see the larger numbers there. And we've obviously also had a number of participants go throughout the other parts of the west of England, and the little 14 sitting there on its own, that's the number of people that have been outside of our west of England, and that's been growing all the time, and particularly with the Senior Leaders Programme. Next slide, please.
So these are some quotes from people who from past participants. I won't read them all out, but it just really shows that picking out some of the areas was that the course should be mandatory for everybody working in perinatal services, that Black Maternity Matters is a journey and a period of continuous learning. Next slide, please. So just some of the impacts that the Black Maternity Matters has had. So some examples of the quality improvement projects that have come out of it. So some of is examples of direct patient care. So whether that is introducing silk hair bonnets in theatres for anybody that has afro, curly or coily hair, to be able to protect the hair, which we know is very important when going into theatre. Having plasters, having black and brown plasters for different skin tones. Educational materials showing wounds with different skin tones, so that we can start to recognize where the biases are on those differences, so that we can continue to learn. We've had people doing research, looking at local data and looking at health outcomes, research into the bias in oxygen SATs probes, and lots around education and trying to continue and spread that learning. So whether it's having the language to speak about anti-racism confidently with colleagues, and embedding anti-racism into all of our education materials and study days. This is so the learning has kind of spread far and wide, and so this is a poem that was written by a consultant neonatologist who was in one of the cohorts in Bristol, and she wrote this as sort of a reflective piece from her time on the course, which has then been published. So it's very nice, from Beth Osmond. Next slide. Another project that we've been doing is very much focusing on continuing that community collaboration. So we've set up an early pregnancy support clinic, which is very kindly hosted in an already running organisation by Refugee Women of Bristol. So we go every week, and we're there to support people with some of the barriers that can come up in accessing healthcare. For example, the booking forms that are online are only in English, which is a massive barrier if you aren't able to read or write in English. So we are there to help people with filling out the forms, giving that early pregnancy advice, in helping people to navigate the services, and just sort of working out bridging the gaps that maybe are coming up as barriers for people women accessing maternity care. Next slide. And there's been collaboration with more organisations, for example, Black Mothers Matter they now run a weekly antenatal group, which is run by Black women for Black women, and it's a really kind of great space to build community. And we have a midwife goes to that group every week as well to kind of continue that collaboration and be able to have a familiar face and continuity when you women come in to have their babies. We've also been able to work with Reframe Photography Project, which is around recognising the biases in textbooks and trying to build a library of photos so that we can recognise different conditions in different skin tones. Next slide.
Thank you. So we have, throughout the whole, every cohort, we have been evaluating through a pre-course questionnaire and a post-course. It's really, we've been evaluating the impact of the training on the participants. We are keen now to move into more looking at the impact on outcomes and experience. That's something that is in our forward thinking. This is very much from the perinatal cohorts that have undertaken the course. Once we had started, and we started with maternity support workers and midwives, we then realised we needed to bring in obstetricians, neonatologists, the wider team. And then since then, we've started the senior leaders, as Laura has referred to. And some of the comments we've had have been that people have found it life-changing. And that has had a personal impact, and a lot of the transformation that we've seen happens personally, and then people taking into the workplace and into that conversation that they have with the woman in front of them. And the senior leaders has really opened our eyes to the power of somebody who's leading an organisation. One of our organisations, the chief executive, who undertook the training, just wants everybody in her trust to do it, and they've now written an anti-racist policy, and that's pretty amazing stuff. I'm conscious that we're probably starting to run out of our time, so I'll pass back to Laura now. Do you want your next slide, Laura?
Yeah. So I'll just talk a bit about the role of the maternity champion, which was quite central in being able to, in the Black Maternity Matters. So I have been midwife for 10 years, as Sue said, and I was maternity champion in the first pilot cohort of Black Maternity Matters, and I always joke that I enjoyed it so much that I came back and did it twice, and I was also one of the maternity champions on the second cohort for Bristol, North Somerset and South Gloucester. Next slide, please. So during the sessions, we are very much participants as well. We are going on the journey alongside all of the other people in our cohort. The role is it's a voluntary position which I applied for, and it was to say that you have either knowledge of some prior knowledge of anti-racism, or having lived experience from the perspective of race, just so that you can kind of be able to support other people in the sessions. So we were there to give some of the clinical context and give examples in practice, and having that slightly more knowledge or lived experience to be able to take the lead in some of the difficult conversations to support Katie and Aisha whilst they're doing the teaching. And you're there as an observant as well of all the participants to kind of help people along their journey. And if you see somebody who's maybe feeling a bit uncomfortable, to kind of, that's the person you go and sit next to, so you can help them to feel comfortable and to engage in the discussions. Next slide, please. And then outside of the sessions, the champion is there to help to continue to build the community. So we set up WhatsApp groups for the cohort. So just to check in at the end of a session if it was particularly heavy, just to see how people are feeling, just general kind of admin and reminders of what for the next session. We were continuing that learning by sharing news articles and relevant things so we can continue that learning. And we also, I guess, just championing the project as much as possible with everybody that would listen, really. So we made contact with Unity Sexual Health, which is in Bristol, and they had their own sort of version of Black Maternity Matters called Black Health Matters, which was part of one of the phases of their one of their health inequalities programs. So we've kind of been able to spread the knowledge and that learning outside of maternity care, but is all still very relevant in terms of reducing health inequalities. Next slide, please. So overall, doing the program, as Anna said, it really is life-changing in so many ways in your personal life and your professional life, in kind of having so much more of an understanding of yourself and the way that we interact with people. And it's really enjoyable to go on that journey with people. Having the champions in each unit just helps to cement that and to continue to implement local changes, and building a community. It really is a community that once you've started on that journey, you don't really ever kind of leave the Black Maternity Matters community. Next slide.
So the next chapter, I won't read out everything that's on there. I think you've got the gist probably of what our ambition is. We will continue to grow our community. We've got over 200 in our community now, and interest from other areas. We're going to be running number of other programs, and another senior leaders program in February. We'll continue with the support for the Quality Improvement Collaborative, and what we found is we're picking up on things that people are doing in other parts of the country. We're getting people together to share their good ideas and how they've managed to really affect some transformation as well. So that our goal would be for everybody to be able to access the Black Maternity Matters methodology, that taking time to reflect, time to learn in between each of the sessions, and then supported with how do you do something when you go back into practice, and how do you have the right environment, and by training our leaders as well, that will obviously help and support the staff. So that's last slide is just a little QR code for you to find out more and to keep in touch with us. So thank you very much.